chance to talk to them this afternoon. Oh, no, it's good. It's good. I'll just send it to you. That's longer. Yeah. Yeah. Okay. I'm sorry so much, Jim. Yeah.
Oh,
I have it on my head if I don't take care.
That's where I learned how to pronounce marijuana.
There'll be more. And my doctor says,
Dave, you're on.
All right, good morning, everyone. Welcome to admin on this Tuesday, November 7th. Annie, would you please do roll call for us?
Yes, online it looks like we have Erica Grande, Jason Hauser, Jason Hausen, Jason Hauser, Karen Hughes, Melissa Fisher, Rebecca Miller, MCAT, and Cindy Kennedy. In 206, we have Commissioners Strohmeyer and Vero, and Hughes, Chris Lansbury, Allison France, Don Hart, Andrew Chorney, Max Redholz, yes, Emmy Bristow, and Carrie Powers.
Okay, thank you. Is there any public comment on items not on today's agenda?
So commissioners, although I'm going to ask that you hold it till the end of the meeting, we did want to walk you through the information that we're putting up on the website around property taxes. And so rather than have that here at the front of the meeting, it is an item that's technically not on the agenda. But yeah, if we could do that during discussion, we'll keep on MCAT so that it can be reported and everything, but just so that folks are aware that will be at the end of the meeting.
And Slotnick was very disappointed he had to miss this. He wants.
Yes.
Okay, yeah, stay tuned. That will be forthcoming in a little bit. Exciting. So consent agenda. Is there any thing that we want to discuss on here or move this forward?
I move to approve the consent agenda.
I'll second that. Any further discussion on the consent agenda or public comment? Seeing none, all in favor?
Aye.
All right, action items. We have 5 today. Karen Hughes. We have our CSKT Missoula County MOA.
Hi, Commissioners. So this is a request to amend the memorandum of agreement with the Confederated Salish Kootenai Tribes. As you know, you'll have the annual meeting later today. I understand from the tribes that they are ready to sign at the meeting. Their chairman signs. This is the agreement that we've had in place for more than 35 years with updates, usually relatively minor ones. The only updates that we're proposing, normally we just approved the MOA last year, so normally we wouldn't do this for another 4 years, but with the passage of Senate Bill 131, which changed the timeline for review of exemptions, we adjusted Section C of the MOA to, it used to say provide a month review time, and we changed it to provide, offer still the request for comment, and in the comment, in that request, we'll put a date by which comments need to be submitted, because it'll depend on the type of exemption as to what the timeline looks like. So that's really the only change, other than we did change just to make consistent, and this is not guided by Senate Bill 131, we are obligated under this agreement to provide the tribes with notice of actions on proposals, and changed the ones in the exemption section to 10 days to be the same as all other actions related to zoning and subdivision. So that is it. And the plan is to actually do the signatures at the meeting later today.
Great. Any questions?
No, I move that we approve the 2020 update of the CSKT MOA.
Second for that. Further discussion or comment on this?
Karen, can I just make sure that I get a completed copy of that after it's signed?
Yeah, absolutely. We have to go through the process of sending it to the Attorney General again.
Okay. Seeing no public comment, all in favor?
Aye.
Okay, thanks, Karen. Bring multiple pens. Yesterday for the John Engen signing ceremony, we had one pen, which took a little longer than anticipated to sign all the documents, so.
One more question. I'm
Yes.
sorry, Karen. Last year when we had the Attorney General try to sign, they said they would not sign because they didn't need to. Have we looked into that at all? She left. Never mind. I'll ask her later.
Sure, we'll get the same response.
So they didn't,
So they said they didn't need to, so they refused to?
we had a signature line on there.
Yeah, and they responded saying that the Attorney General's signature was not required on this document, and so we processed without it and just attached the email.
So what makes us think that the Attorney General needs to sign?
I don't know. I'll reach out to
Yeah.
Karen. I'm
I'm
sorry.
not sure.
Yeah. I'm just not sure. I remember last year when I was trying to obtain it, that was the response and we had to just roll with it. They're really hard to get to sign documents. So this one sticks in my head.
We can't just erase that signature block and not have them sign it at all.
Yeah, I'll reach out to Karen and.
Yeah, we'll figure it out.
Yeah, yeah.
Yeah, white out.
People even know what whiteout is.
I have
Okay,
some on my desk.
all right, thanks. Erica, what do you have for us?
So we have the benefits plan amendment. You'll note that we're asking that it be effective retroactively from July 1 forward. The delay is primarily related to the first amendment that we're proposing, which relates to federal law that allows for an extension for those who lose coverage through federal insurance. So this ties primarily to Medicaid right now, because there's been the change in eligibility post-pandemic for Medicaid. You're seeing a lot of Medicaid insureds losing coverage, and notice of that loss of coverage has been significantly delayed. I have Rebecca Miller on here who can speak to some anecdotal situations, but specifically what's happened is Medicaid insureds will find out weeks after they've lost coverage. And so if we were to stick to requiring them to enroll within 31 days of loss of coverage, which is what our plan says right now, they wouldn't be eligible to get benefits through our plan. So essentially, federal law is recommending that we expand that time frame to at least 60 days to allow for those individuals to come on the plan. We've been operating under this practice because obviously this is a huge shift. This is primarily impacting children who have been under like Healthy Montana Kids type programs, who are no longer eligible for those programs given the feds, and primarily the state's change in terms of what they're allowing. So that is the backstory on why you're seeing this so late. So that's amendment number 1, is essentially we're going to put language into the plan that says that 31 days will be expanded as required by federal, state, or local regulation. The rest of these I'll walk through pretty quickly, but please stop me if you have questions. We are amending our requirement for sleep apnea equipment to no longer require prior authorization for the equipment. This is due to the fact that we hardly ever see a situation where the equipment is denied. Meaning if someone goes in for a study, their doctor requires the equipment, we send it off for outside review, it's never going to be denied. So there's just no reason to have that prior authorization. If a doctor's ordering it, we're going to pay for that equipment. Physical therapy benefit, our plan language has stated that there's a 21 visit limit per injury. We have actually operated under not sending out physical therapy for medical necessity review for those first 21 visits. And then when someone hits the 21 visits, we send it out for review to confirm medical necessity. So we're changing the language to reflect that practice. We actually don't have a limit. We cannot have a limit under federal law. So our language will reflect that we will be sending out for review upon that 21st visit.
Erica,
Yeah.
where does the number 21 come from? Why not 20 or 22?
Well, we could pick any number. If Rebecca wants to jump in to talk about the 21, that would be helpful. I mean, I think that part of it is from our examiner's perspective.
I'm gonna be honest, I'm not quite sure where the 21 visit comes from. I mean, I can make lots of guesses, but when I review plan documents from other plans, that was pretty standard. But I don't know, I'm sorry, I don't know where the 21 came from. I just know that that's a number that a lot of payers use.
And I think it's fair to say 21 PT visits for a single injury is actually pretty high. The only time you're going to see beyond that is for pretty significant surgeries or the sort of trauma that is going to require continued PT in order for someone to be able to function.
No, I agree. It is pretty high. It just seems like a very specific number as opposed to a nice round number, 21. So anyway.
I think it probably came from, if you're going to physical therapy 3 times a week for 7 weeks, that's typically what we'll see. When we have a referral, it's usually 2 to 3 times a week for 6 or 7 weeks. So I wonder if there's something to do with that. 3 times 7 would be 21. So.
Andrew, is that correct? You're right. Erica. Thanks, Rebecca.
Thank you.
So next one, telemedicine. This is an amendment coming out of pandemic practices. So we're continuing to allow telemedicine at preferred providers on the plan, and we'll continue to exclude coverage for telemedicine at non-preferred providers. Just so that the commission's aware, we work pretty closely with members who may be seeing specialists that are out of network to get those providers in network when we need to for telemedicine. So meaning if we have someone seeing a specialist out of state, we're working pretty closely with members to see if we can't find a way to allow for that telemedicine, so we're not requiring people to travel for those checkups and that sort of thing. The next one, I will have Rebecca jump in here. We have some definitions that are being updated. The first, I think I can handle. So we are adding occupational therapy assistants, physical therapy assistants, and then also licensure candidates for clinical professional counselors, chemical dependency counselors, and social workers as eligible providers that we will pay for their services. A lot of this comes out of just changes in how the medical world is covering the need for services. So the first two, OT assistants, PT assistants, we are just seeing more of those provider types in those settings. And so we want to make sure we're paying for those. The second piece for the licensure candidates, we have a dramatic shortage of mental health workers in our community and in our state. And so being able to pay for the licensure candidates really expands the providers available to our plan members. And so we just think it's really important to be able to pay for those services. Also, those candidates are being overseen by licensed professionals. The next two, I'm going to let Becca jump in on the custodial care and the skilled nursing.
Yeah, so when we're looking at the plan document, the plan states that it does not cover for custodial care. It does state for skilled nursing care, but there was not a definition in the plan document. So this is language that's being added to the plan document to clarify exactly what custodial care is and what skilled nursing care is.
Can you, I don't have the document in front of me. What does it say?
The definition.
Yeah, definition is it
So
super long or is it, are you able to read it?
No, I could definitely read it.
Okay.
Custodial care is non-medical care that can reasonably and safely be provided by a non-licensed caregivers, including but not limited to bathing, dressing, cooking, household duties. And skilled nursing definition is medical care that can only be provided by a licensed medical provider, includes but not limited to physical therapy, wound care, intravenous injections, and catheter care.
Great, thank you.
Yep.
All right, the next section has to do with chemical dependency, mental nervous condition, definitions and coverage. So here our plan currently indicates that in order for facilities for this sort of care to be eligible for payment, the facilities must be a Medicare provider. And this is specific to inpatient treatment. The challenge here is that when we think about Medicare, Medicare typically, the typical insured is 65 and over. And so Medicare is use of these sort of facilities is not that high. Let's just put it that way. And so there's not that many facilities that are deemed eligible Medicare providers, meaning the facilities are not contracting with Medicare because they have enough business outside of working with Medicare. So we were finding that we did not have enough access for our members if we were going to stick to this requirement. And so really what we're doing is indicating that the facility must either be approved by Medicare or have accreditation from the Joint Commission, which is also a federal body, and be licensed in the state where the facility is located. So adding that second qualification in terms of the Joint Commission and state licensure, we're capturing the bulk of these inpatient facilities across the nation. And so really expanding access for members to those facilities. Am I missing anything, Becca?
Nope, well, I would add a little bit more to say that we're also adding definitions for some of the treatment that were being requested. So for these types of treatments, they do have to be pre-certified. But it doesn't, the plan document doesn't state what criteria needs to be met for that treatment to be covered. So we're adding language into the plan document that clarifies what each treatment type is and what type of facilities can administer those services.
So just so you're aware, specific to that, there's the full residential, which I think probably most of us understand being that full inpatient treatment. There's this partial hospitalization, which is essentially what it says. It's part inpatient, part not inpatient. And so basically the plan's only covering the medical services. So any sort of residential component that is not part of the medical treatment is not covered under the plan. And then there's also intensive outpatient treatment, which is you're residing in the community, not in any sort of residential capacity, but you're generally attending treatment the bulk of the day. And so there's also a definition for that type of treatment. And a lot of programs, it's that step down. So you'll start with residential treatment, potentially move to partial hospitalization, but oftentimes move into that intensive outpatient if it's available. All right, so moving on from that, we have an amendment for the vision plan for corrective eye surgery. We are just increasing the benefit for that surgery to match the dollar amount that's available for glasses or contacts. So it's just increasing that limit to $226 for that surgery under the vision plan. And then COBRA, we're just cleaning up language so that we are in compliance with federal law. That basically states the maximum amount of coverage available under COBRA when an additional qualifying event occurs when you're already on COBRA. It does not expand that benefit. So you can only be eligible for 36 months of COBRA coverage entirely. So an example of this is an employee terminates coverage with, or terminates employment with Missoula County. They elect COBRA coverage. They have their spouse on the plan, and the spouse also elects COBRA coverage. If the terminated employee during that COBRA coverage period passes away, the surviving spouse is still only eligible for up to 36 months of coverage. And so we just wanted to clarify that within the plan, because we've had not just that specific scenario, but we've had a couple of scenarios come up where it's been unclear in terms of if the additional qualifying event allows for expansion of coverage. So what I'll tell you is most of the things in here are practices that we're already doing within the plan. I would say the only section where we know we'll need to go back and review claims from July 1st forward is that expansion in coverage for occupational therapy assistants, PT assistants, and licensed candidates for the mental health professionals. We can do that, I'm told, fairly easily, and we'll go back and pay any claims that have been denied, and which will likely just amount to reimbursement to our members for services that they've had to pay for out of pocket.
Questions?
That's a lot of updating. Thanks for combing through all of that. I move to approve amendment 8.3.
Second, any comment or further discussion? None, all in favor? Aye.
Aye.
Thank you.
Thank you, Erica and Becca.
Thank you.
I misread the first part of this somewhat dyslexic fashion. I thought you were talking about road court of some sort. Michael Court Road.
Oh, yeah.
Ben, before I get into this, just for the record, if I ever have to go to more than 21 sessions of physical therapy, I would ask everybody in this room to just put me down. I don't want to do that. You got it.
Hesitation.
That's right, Allison. Cheers. So more to the point, I'm bringing to you this morning a request to accept a portion of Michael Court Road as public right-of-way and utility easement. So this past summer, I was contacted by a local attorney who had a client, Elizabeth Getz, who has a road that went in front of her property. Here it is. Oh yes.
Thank you.
Is kindly sharing her screen. So Ms. Getz lives there at 12405 Michael Court.
Can you tell me where? I don't know where we are.
We are in Lolo.
Oh,
We're east of 93. You can see the railroad tracks there in the far left side of the screen. The river is
to the north.
Is to the east.
Oh.
Not that far away. And anyway, Ms. Getz's attorney said that, explained to me that she was having some problems with her neighbors using a portion of Michael Court that goes from, what we're looking at here is a portion of Michael Court that's highlighted in blue. That's already public right of way. That's one way to her property. Missoula County's maintained that section of Michael Court for a number of years. But then to the south, which is not highlighted in blue, is not at this time public right of way, but apparently has been used by the neighbors, the UPS guy, emergency responders for any number of years. And Ms. Getz was possibly not excited about people using that section of the road, such that maybe she suggested to some people they should stop using that part of the road. So the neighbors hired another attorney to allege that there's a prescriptive easement for them to use, and this past summer they were on the cusp of litigation. Anyways, Ms. Getz's attorney propose to me, would Missoula County accept this disputed section of Michael Court Road as public right of way to clear up this litigation? My client doesn't, want to go to court over this. Recognizes that there may be some private prescriptive rights, but would prefer it to be a public right of way. I talked to folks in the Public Works Department about whether or not this would be public right of way that would be in the best interest of the public to accept. They said absolutely, because as it is now, they plow Monty Lane to where the blue line ends, and then they plow Michael Lane and Michael Court to where the blue line ends, and they turn around at both ends and go back.
And so 12492 doesn't get any.
Well, she gets it up to that sort of the cul-de-sac there, exactly where the cursor is.
Oh,
So having this be public right of way would actually be a good thing in terms of maintenance in Lolo. They can make a loop out of it instead of two dead end turnarounds. So that's where we are today. Steve Nide did a survey of the right of way that Ms. Getz is willing to donate. That's part of this dedication document that's in front of you today. And she signed it, and the neighbors are happy. The neighbors' attorney's happy. Everybody is going to be happy. And so with that, I recommend that you accept the dedication of Michael Court Road as a public road and utility easement as depicted on Exhibit A of document.
okay. Is Michael Court Road? That says Michael Lane, or mine.
There's Michael.
Michael Lane and Michael Court Road.
A little confusing. This is Michael Lane to here. This is Michael Court.
Oh, it's Monty down. There we go. Okay.
This is Monty, a lot of M's here. And so the dedication would essentially be from here to here. And just for the record, Michael Court from here to here is 54 feet wide. It will be 54 feet wide from here to here. But from here south to Monty Lane, Ms. Getz only has 30 feet of property. She's granting the right of way over all of that 30 feet, but it will not be 54 feet. And that's okay with Public Works also.
Okay, so in this case, it's not the adjoining property owners who own to the center line.
No, this is a unique piece of property where she owns that essentially worthless sliver of 30 feet of property. Yeah, I don't, this was platted on a COS back in the 70s or 80s. And it was platted that way. So,
Fascinating.
yeah.
Well, I don't know. Maybe we should just drag this out even longer. I'm glad you were able to find a way to make everybody happy. That's a great story.
It is fun to have a solution that works for everyone, including the UPS man.
Yeah. I move to approve, or I move that we accept a portion of Michael Court Road as public right of way.
Any further discussion or public comment on this? Seeing none, all in favor?
Aye.
Thank you, John.
Thank you.
All right, Cindy Kennedy, Buena Vista. Wow.
Buena Vista.
It's on giving.
Yep, it's not giving. Can you guys hear me okay?
Yeah.
Great. So yeah, Cindy Kennedy, Grants Administrator. I am requesting that the board approve the chair to sign a Buena Vista change order number 6. And this covers the cost of pest extermination below homes, actually spiders, poisonous spiders, to allow workers safe access for connecting each resident to the new sewer line. And The cost is $13,683, and our budget can support that cost. And hopefully this is the last change order I bring to you. Probably not the last item I'll bring to you for Buena Vista, but hopefully the last change order. Any questions?
What kind of pests?
Black widow spiders.
Oh, I missed that.
Yeah, predominantly spiders.
That is a new one.
We don't, yeah, it is. We don't want the workers to get bit. So it would feel much safer. Unfortunately, some of the homeowners are refusing to allow them to exterminate. It's entirely safe. It's organic. They can stay in their homes. But there's some that don't want any exterminating happening below their homes.
So how is that? How are we navigating that? We're just not going to do any work under those homes, or?
Oh, no, they have to. They just have to do it. They just have to be careful. The cold weather's helping a little bit. The spiders become a little bit more dormant, but
Sleepy.
Slow moving. Poisonous spiders.
that cost of $13,000 will probably be a little less because of that.
Okay,
I move that the board approve the chair to sign the Buena Vista change order.
second. Any discussion, further discussion on this or public comment? Seeing none, all in favor?
Aye.
Aye. Okay,
Great, thank you.
no one will get bitten under the homes that do not allow access. Okay. You are not Adrian, Max, but I'm assuming you can talk about this next one.
Yep. Yeah. So I'm Max Rebels, work for Missoula County Emergency Management, filling in for Adrian on this one. We applied for a grant to treat 32 acres up in Marshall Canyon called Izzy Dog LLC. A little bit more background to that is the Forest Service and the city are treating lands around that area. It's this random triangle chunk of 32 acres. And it's just kind of this isolated triangle now that hasn't been treated for wildland fire fuel reduction. So we applied for this grant through the International Association of Fire Chiefs Race at Go program. The Race at Go program helps fire services and emergency services by providing educational and financial resources to those agencies to do fuel reduction projects. So we applied for this grant and we got it. We have a deadline to use this money by September 23rd, 2024. And so the plan is to utilize like Montana Conservation Corps, Missoula Rural Fire Department, Team Rubicon to treat that 32 acres this summer, which is a pretty good price for $20,000. Usually the going rate's around $1,500 to $1,800 per acre. So if we can treat that 32 acres, $20,000, that's a good bang for our buck. And it creates a landscape in which, you know, Forest Service, city, and then, you know, this Izzy Dog LLC piece, which will soon be, you know, Missoula City County ownership, to be all treated. So the ask is for the chair to sign this grant award by November 10th.
So the 32 acres, what's in that 32 acres? Is this surrounding the buildings there or?
So there is a home site. It's I think it's Aileen Flanagan, but she owns just maybe a tenth of an acre, a third of an acre there. But all around it is this Izzy Dog LLC, where the fuels are built up, super steep terrain. And that's the idea, is kind of treat that area and then hopefully work with Aileen to treat her side of the fence too. But there is no infrastructure on this 32 acres of Izzy Dog LLC.
Aileen's on the west side of Marshall Canyon Road. And I bet this is, you know how the service been doing that. I can't remember the name. It's like Marshall something fire project over the course of years on all that landscape up towards the saddle above Woods Gulch and the ridge line that then goes on up to Blue Point and that. I bet that's to sort of close the book on all of that landscape work. That's a guess though.
Yeah, no, that's exactly right. I mean, I wouldn't necessarily close the book, but it would just tie into the existing projects that are going on. And then the Forest Service offered to help burn the piles. If we were to treat that land, they could go and burn their piles through, it's called a Wyden Authority, you know.
So will any of these dollars be able to be used on the adjoining property? Is it Eileen?
Yeah, it's Eileen Flanagan, I think.
Oh, she just has a tiny little piece, yeah.
It seems like that is the higher priority. If we do this work and she does nothing.
Yeah, we can.
Thanks, Chris.
Help her.
So that's the Izzy Dog parcel right there. Max, that we're
Yep. So the west side of Marshall Canyon Road.
a little too far. Sorry about that. Should I have really slow refresh on the television? Yeah, man. There we go.
Just going a little.
Yeah.
There, still there. You can see Eileen Flanagan. Very
Steve.
Red dot.
A little red dot in the middle, a middle red dot. So
Is she the 52 or the?
No,
she's that one in the middle. So yeah, that would be the hope, is treat her as well, but the larger landscape, you know, that's what the 20,000 is dedicated for. But we can certainly, if she's on board to treat her property, I haven't taken a super close look as to the need on that or what the expected cost might be, but the idea is to kind of try to tie in with what the Forest Service and the city has done. You know, hopefully work with Eileen too on treating her side of the fence.
Yeah, and for what it's worth, if there's a way in which we can use this to treat her property.
Yeah,
That would, I think, open up opportunities for other land management without doing prescribed burning or something landscape out there that will help mitigate the pucker up factor if you're trying to do that and worry that her.
Oh, it's not even an acre.
yeah,
0.8.
yeah. It's a small chunk. But usually how this stuff goes is you start treating around her house, and then she'll see the work that gets done and she'll want to hop on board and treat as well. But there's definitely going to be some discussions with her before we, you know, take a chainsaw to some trees.
Because her view out her window is going to look different.
Yeah, for sure.
It'll look a lot different. Totally consumed. So, okay, thanks, Max. Any questions?
No, thank you. And congratulations on getting the grant.
Yeah, thanks. Yeah, it was kind of quick application, learned about it, and then like 10 days later, the application was due. So,
Well, I move to approve, or that the chair sign the grant award.
Further discussion or comment? All in favor?
Aye.
Okay, thanks. Next, we have one piece of correspondence. This relates to the jail inspection that Juanita and I did last week out at the detention facility.
It is just our standard letter back to them saying the jail inspection has been done. And so it's the letter we do each year.
Hey.
The facility.
I'm actually it was a good little tour and discussion, and I'm proud of what they are able to do out there.
Yeah.
Compared to other jails around the state. Oh, yeah, we just finished. Yeah, they had just cleaned up after
Yeah.
some plumbing.
They were having some plumbing issues for sure.
It was sparkling when we got there.
Yeah, it really was. Okay, anything else we need to talk about? Oh, yes, there was.
Sorry.
I think it was like 40 minutes before I was. Okay. Share my screen here.
Josh needs to sign it.
Okay. Okay. So commissioners, as you know, tax bills are going to be hitting mailboxes this week. It sounds like 2,000 went out yesterday, and then the bulk of them are going out today. So property owners will start getting those bills in the mail. And
Those bills include a short note from the three of you that points to this website, missoula.co/taxes. And this is where the page it will take people to when they go to that. And it's just kind of a short explainer, high-level explainer about how your property taxes are determined. First, and who's responsible for what, importantly. So property reappraisals, of course, are the State Department of Revenue conducts those every 2 years. And as we know, this is a reappraisal year, and most property owners across the state saw huge increases, a 36% average increase in Missoula County. And that has a big impact, probably the biggest impact on what people will pay in property taxes this year. And we talk about the tax rate, which is what the Montana legislature determines each time they're in session. And the tax rate this year for residential properties is 1.35%. And typically in the past, when there has been a big bump in residential property values, they have bumped that down to 0.94 to help kind of even out increases. But that did not happen this last session. So
I think it was suggested to be 0.94.
0.94, yep.
I don't think they hit it at any specific point in the past. It was different.
Oh, it's different every year. Okay, thank you for that clarification. Yes, this year, the Department of Revenue had recommended bumping it down to 0.94% for residential properties.
I'm sorry, that sentence, this year the legislature chose not to even listen. Wait, I'm sorry, I can't read.
This year, the legislature had the option to lower the tax rate on residential properties from 1.35% down to 0.94%, but chose not to, even with the substantial increase in residential property values.
Here, I can make the text on this bigger.
Yes.
That is helpful.
It's hard.
Try that. There we go. Is that better?
Yeah, thanks.
Okay. And then, of course, another piece of people's property taxes is both the county budget and also budgets for all the other taxing jurisdictions. But this just gives a brief overview of the budget process the county goes through. And then we also have tax collection. Oh, sorry. There we go. Okay, yes, it's where I want it to be. Missoula County collects taxes for all the jurisdictions someone might live in, and then we disperse that. So this is just clarification that when you're writing that check to Missoula County, it's not all going to Missoula County, it's going to.
So is that said there? Like, just that sentence?
I think so. Oh, do you want me to say when you write the check? That language.
Is that what we're hearing from people, like that frustration? Or that?
I think just confusion or people, because you write a check to Missoula County, so of course you would maybe insinuate that.
Yeah,
all those taxes
just
are going.
that super plain sentence.
So you don't think that captures it? Missoula County collects and distributes taxes for all taxing jurisdictions. Much of the taxes you see on your tax bill support jurisdictions other than the county.
Yeah, I think beat the dead horse.
Yeah, we can start it out with when you write that.
I think all that the words are great and the language is great, but then at the end, like that sentence, you write the check. It doesn't mean that it's going to Missoula County.
Right. Yeah, we're the bank essentially. Everyone else. Okay, so that's just a general, really high level overview of just who's responsible for what in determining your property taxes. And then we also have this drop down menu here. And bear with me, it's a little bit wonky, so I'm going to do that. So it's showing it. That is just an overview with descriptions of all the different line items that people see on the county portion of their taxes.
This is great, Allison. Wow.
So a lot of work from Carrie on this too, so I'll give her credit there.
Great.
She built this, so I don't want to take that credit. So just, as short of descriptions as we could get with all the different line items, which I will just pull up. Right here. So so this is my tax bill here, and it just to have a reference here, when you have your county portion of your tax bill, we have all these line items here. And so that's what these are descriptions.
Great.
And we'll do some social media posts of some of the bigger ones that people will see, just to help direct people to the page and hopefully learn about what their taxes are going forward.
This is awesome.
This is really, really great.
So
Yeah.
great, you guys.
And that's pretty much it.
And then even all those, that amazing drop down, all of that is just the county portion, which is a small portion of the total tax bill.
Right.
That we don't have any control over the majority of your tax bill.
Right. So exactly. So if you live in the city and Missoula County Public Schools District, you're going to see this for the city, just the general fund, and then some line items for schools too. And then of course, if you live in other taxing jurisdictions, those will be on there, but we can only speak for the county's part. So that's what we're doing.
Yeah, really great job. Thank you guys.
Thank you. Great team. So.
Yeah, you do.
The SWOT infographic.
I just love that the word magic is on there. Great job, you guys.
Thank you. Anything else, anyone? Hey, have a good day.
Thanks.